Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And every once in a while we need to go back to basics. What is ABA?
Ooh, I love that one. So it's so fun to talk about what is ABA. ABA is it says applied behavior analysis, and it is based on the area of psychology called operant conditioning. It's a part of psychology, and it's kind of a learning technique, teaching technique, right? But it's based on operant psychology, operant conditioning, which says any behavior that is followed by a reinforcer is going to increase. And any behavior that is not followed by a reinforcer or reward is going to decrease. Now, forget about autism for a minute and just apply that to normal behavior, life, right? So you go to work, that's the behavior. And what maintains that behavior? Why do you continue to go to work? Because you get paid. That's your reward. You get paid. Now, sometimes the amount you get paid is not enough, but your social environment at work, your friends and colleagues, adds to the reward. And bottom line, the reward, the reinforcer becomes enough to keep you going to work. If suddenly you didn't get a paycheck, trust me, you wouldn't go to work. Most of us will not go to work if we don't get something out of it. Okay. Now, and you could be getting other rewards out of it aside from money, obviously. So look, now take that concept and how do we apply that concept to autism and the treatment of autism? We list a bunch of symptoms or behaviors that we see in the individual. For example, this child doesn't have enough language skills, doesn't have enough social skills, doesn't have enough play skills, but they have too much tantrums. They have too much aggression. They're communicating with really a lot of challenging behaviors. They run away, they hit, they fight, all that, right? So I want to decrease these and I want to increase these, right? I want to decrease those challenging behaviors and I want to increase those skills that are a little bit behind. So what do? The ones that I want to decrease, I make sure the child doesn't get rewarded when they do those behaviors. What does that mean? That means whenever a child tantrums, I figure out why they're tantruming. Are they tantruming because they want to try to gain access to an object, like get a toy from another child? Are they tantruming because I just told them we have to get ready and go and they don't want to go? There's always a reason. And I do the contrary to that reason. For instance, if the child wants to get access to a toy when they tantrum, I make sure they don't get access to the toy. And that teaches the child over time, hey, every time I tantrum, I don't get any kind of reward out of it anymore. Remember the concept? Reinforcer is not there. So that behavior goes down. As that behavior goes down, it also is super important that I teach appropriate skills, this side of the angle, right? So all of these things, the social skills, the language, the play, the adaptive, all of these things that are behind, you model them and you get the child to do them and then you reward them. And so these are increasing. So you're teaching adaptive skills at the same time, you are reducing these challenging behaviors, and then you get to kind of a balance, which is what we find in neurotypical kids, right? When neurotypical kids, they also tantrum. They just don't always tantrum when they want to communicate. And we try to make it so that our children learn to use their language, their social skills, etc., instead of these challenging behaviors. And then that's kind of ABA. And then, of course, it gets more advanced as the child ages. And the idea with ABA is to get the child to a point where they can just learn from general education and keep going.
And I just want to say, in case they didn't get it, because it was so eloquent what you were saying. So Because a lot of times people miss the finer point that you don't just say, no, I'm not going to give you the toy for the tantrum. Over on the other column, you're teaching them how to appropriately ask for and get the toy. Did everybody get that?
Right.
Because that's what's key. Because when I'm the child, if I've learned that if I throw the tantrum, grandma gives me the lollipop, right? Then I'm going to throw the tantrum because I want the lollipop and that's what's required. And if I find that every time I throw the tantrum, I don't get the lollipop, but if I just nicely say, can I have a lollipop? Then grandma gives it to me. It is easier for me to ask for it than to throw the tantrum. Once I've learned how.
That's key. And that's important because you don't have to also, like, a lot of times I'll say that, Shannon, and then a parent will come back and say, but my child's nonverbal. It doesn't matter. Your child does not have to say, can I please have the lollipop? They can point to an icon of a lollipop. And every child can learn to do that. And that gesture, that particular touch an icon, touch a picture of a lollipop, touch the lollipop, that kind of thing is going to be easier than the effort it takes to tantrum. And it is very, very important to teach those replacement skills.
Well, it's fair.
It's fair. It's fair.
This is the thing.
That's right. And if you don't, let me tell you, you'll know right away because your child will stop the tantrum, but they'll do something else.
Yes.
Which is maybe they'll throw an object now or something like that. So it's super important to make it fair and positive.
Yeah. Good ABA is going to give them the skills to get their needs met. I think this is what people miss out on all the time.
That's right.
But it has to be fair or that's not happening. So I so appreciate that. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.